Good evening. Welcome to the National News Broadcast. I'm Kasuni Balachandra.
And I am Tilina Uderatna. Coming up are your headlines for tonight. Today we complete 12 years since the end of the Civil War. Prime Minister Mahinda Rajapaksa emphasized the victory achieved with many sacrifices will not be betrayed amidst any challenges. The draft bill on the Colombo Port City Economic Commission with amendments can be passed with a simple majority. The Supreme Court determination submitted to the Parliament. 185,000 doses of the Sputnik V vaccine will arrive in the country on next Tuesday. The President observes the COVID-19 Intermediate Treatment Center in Sidua. Itukama is emphasized as a transparent fund. First up, we take a look at local stories. Sri Lanka commemorates the 12th anniversary in freeing the country from the grasp of the LTTE terrorism. The final journey of the LTTE organization, which showcased its violent brutality to the entire world, began in the month of July 2006 after the LTTE suspended an irrigational water supply in an effort to exhibit their separatist ambitions to the global community. The LTTE terrorists damaged close to 30,000 acres of agricultural land in the Serunura agrarian villages after suspending the irrigational and drinking water supply by closing down the Serunura Mavil Aru Anicut. Accordingly, humanitarian operations commenced to liberate the Mavilaru Anicut and restore water supply after the terrorists denied the request made by the government. Consequently, the Sri Lanka military was able to successfully complete the operation and provide the water supply for agrarian purposes. Subsequently, then President and present Prime Minister Mahinda Rajapaksa ordered the Tri-Forces to commence the operations to completely eliminate the activities of the terrorists in the eastern province. Accordingly, strategic operations to eliminate terrorism in the eastern province were commenced by the Tri-Forces under the coordination of then Defence Secretary and current President Gotabaya Rajapaksa. The humanitarian operations were extended to LTTE-controlled Sampur, Toppigala, Kanjikudichiyaru, Verugal, Peraru, Vakare and Kadiraveli areas. Accordingly, the Tri-Forces were able to gain complete freedom for the resident communities in the eastern province in the month of July 2007. Subsequently, the humanitarian operations were commenced in Silavatura and Mannar areas in the northern province. The 58th Brigade, led by present Army Commander General Shavendra Silva, was the first brigade to free the area and continued its operations up to north from Mannar via Adampan. Accordingly, the 57th and 59th Brigades took their first steps to eliminate terrorism from Irane Iluppaikulam and Valioya in Vaunia respectively. The 2nd, 3rd and 4th Task Brigades commenced their operations from Palamote, Vannivilankulam and Nedunkarni areas respectively. Meanwhile, the 53rd and 55th Brigades in charge of the security circle in Kilali, Muhammale, Nagarkovil began to ascend towards the south while penetrating terrorist defences. Accordingly, the 8th Task Brigade joined the humanitarian efforts in support of the battalions which were pressurizing the LTTE terrorists from 9 frontline engagements. In February 2009, the LTTE terrorists were limited to a couple of square kilometers of land in Pudukudurippu, which was suffering a heavy blow from the frontline operations. However, they used the civilians of the area as a human shield. Accordingly, the war heroes were able to engage in their humanitarian efforts without incurring any damage to innocent civilians using military strategies and plans. The military was able to secure the terrorist-controlled area after rescuing the civilians and declared victory against terrorism on the 18th of May 2009. The declaration on the complete elimination of terrorism from Sri Lanka was made after the death of the LTTE leader Velupillai Prabhakaran on the 19th of May. The Sri Lanka Navy and Air Force, as well as Sri Lanka Police, the Police Special Task Force and the Civil Defence Corps, under the coordination of then Defence Secretary Gotabaya Rajapaksa, contributed immensely for the humanitarian operations. In the past, the war heroes engaged in a humanitarian operation to free the civilians from the clutches of terrorism. Today, they are in an effort on the front lines of a humanitarian effort to save the nation from a global pandemic.
Prime Minister Mahinda Rajapaksa, addressing the Parliament today, emphasised that the victory achieved with many sacrifices will not be betrayed amidst any challenges. The Prime Minister made these remarks while delivering a special statement to mark the 12th anniversary in freeing the nation from the clutches of the LTTE terrorism. Prime Minister Mahinda Rajapaksa said that 12 years have been completed since the 30 years of terrorism have been swept away from the country. He said that the entire nation, together as one, celebrated the achieved victory on 18th May 2009. He said that they were able to free more than 400,000 hostages from the terrorists who had used them as human shields. He added that the era where the people in North and East lived as refugees in many areas across the country was ended by them. He also said that they were able to facilitate the opportunity for the people in Eastern Province who lived in refugee camps for more than 20 years to return to their respective residences in order to live a normal life. He added that the residents who lived in areas known as border villages endured a fear-filled life amidst the conflict situation. The Prime Minister said that today marks the day when the country became a free nation without any fear for life. He said that the war victory is an immense victory achieved by the Parliament as the LTTE terrorists began their activities following the killings of public representatives. He added that many lives of public representatives, including Dorayappa Amirathalingam to Sam Thambimuthu, were taken away by the LTTE terrorists. He also added that the lives of parliamentarians, including R. Premadasa, Lakshman Khadiragama, Gamini Disanayaka, Lalit Atulat Mudali, Jairaj Fernando Pulle, D.M. Dasanayaka and C.V. Gunaratna were lost due to the brutal activities of LTTE terrorists. The Prime Minister said that the holding of elections in North and East provinces was made possible following this victory. Accordingly, he added that public representatives in North and East provinces were prevented from travelling across the provinces and to engage in politics with the public and then represent them in the Parliament due to the prevailing situation. He said that many lives and limbs had to be sacrificed in order to claim this victory. He added that those who engaged in the war had no intentions in committing a massacre. He said that former Defence Secretary Gotabaya Rajapaksa, former Army Commander Sarath Fonseca, former Sri Lanka Navy Commander Vasantha Karanagoda and former Sri Lanka Air Force Commander Roshan Gunathilaka never led their troops to commit any massacre. He said that the military had to fight against terrorists who had used people as human shields and retaliated behind them. He said that it was the intention of the military chiefs to engage in fighting with the terrorists while protecting the human shield, which they accomplished successfully. He added that those who were considered as soldiers were later recognized as war heroes for their dedications and unerring resolve during the humanitarian efforts. Accordingly, he added that separate hospitals and schools were built on behalf of them, while they were also directed to diplomatic service requirements as well. He said that they were given promotions in state services and increased their salaries, allowances and other compensations. The Prime Minister further said that a decision has been reached to remove the interest from the property loans acquired from the government by the war veterans who were disabled during humanitarian missions. The Premier further said that the war heroes are currently engaged in a battle with an outbreak in the country as frontline workers. He said that many criticisms had been levelled against them for using the military in the fight against the prevailing outbreak in the country, similar to the period of the humanitarian operation. He said that these war heroes will become role models to the world in combating this outbreak, as they previously did in their interest operations against the world's most notorious terrorist organization. The Prime Minister emphasized the great quality of the nation in protecting the war heroes. Therefore, he said that the government withdrew from the disloyal resolution which was co-sponsored by Sri Lanka at the Geneva Human Rights Council against war heroes. He said that war heroes sacrificed their lives to render freedom and peace to the nation, therefore emphasized that the victory achieved with many sacrifices will not be betrayed amidst any challenges. The Supreme Court has decided that the draft bill of the Colombo Port City Economic Commission can be passed with a simple majority along with several amendments. Speaker Mahinda Yalpabewardena delivered the Supreme Court determination in the Parliament today. Meanwhile, the Cabinet of Ministers headed by the President has granted approval to include necessary amendments in accordance with the determinations of the Supreme Court. Speaker Mahinda Yalpabewardena presented the determination of the Supreme Court on the Colombo Port City Economic Commission draft bill at the beginning of the parliamentary session today. The Supreme Court determination has indicated that the majority of the clauses in the draft bill can be passed with a simple majority in the Parliament. However, the determination has pointed out that the two-third majority is required to pass several clauses in the draft bill. The determination has further indicated that if the relevant clauses can be amended, then the amended clauses can be passed with a simple majority. Meanwhile, the Supreme Court has determined that another couple of clauses should be passed with a special majority and through a referendum. However, it has further indicated that if the relevant clauses can be amended, then those amended clauses can be passed with a simple majority. Minister Keheliya Rabukwala said that over 21 petitions were filed against the draft bill and the government side had also filed intermediate petitions accordingly. He said that the government party also presented amendments to the draft bill during this occasion. He said that following the submission of the proposed amendments, the Supreme Court has submitted its determination to the Speaker, citing that the draft bill can be passed with a simple majority in line with the proposed amendments.
අවස්ථාවලදී අපි එකඟ වෙච්ච සංශෝධනයන් ඉදිරිපත් කරාට පසුව එය සුළු බහුතරයකින් සම්මත කරගන්නට හැකියාවක්.
Mr. Presiding Member, there is some misinformation which is circulating throughout the country regarding the effect of the Supreme Court determination that was announced to this August Assembly by the Speaker this morning. It is being said that the Supreme Court in its determination has declared that a two-thirds majority and a referendum is required in order to pass this bill. That is totally, entirely incorrect, Mr. Presiding Member. The government, through the Department of the Attorney General, submitted to the Supreme Court a series of amendments. The court has accepted those amendments, and that is clearly referred to in the determination that was read out this morning. On behalf of the government, I stated yesterday that the government is accepting in its entirety the amendments which have been suggested by the Supreme Court. So during the committee stage on Thursday afternoon, the government will move those amendments. They will be included in the bill. And with those amendments, the bill can be passed in this Parliament with a simple majority. That is the effect of the determination of the Supreme Court. There is no doubt whatsoever. There is no need for a two-thirds majority. There is no need for a referendum. The bill can be passed with a simple majority.
State Minister Professor Channa Jayasumana says that a total of 185,000 Russian-manufactured Sputnik V vaccine doses will arrive in the country on next Tuesday. The administration of the second dose of the Covishield vaccine and the first dose of the Sinopharm vaccine under the COVID-19 immunization program is underway at present. Accordingly, 25,380 persons have received the second dose of the Covishield vaccine yesterday. 292,457 persons have been administered with the second dose thus far. 49,507 have received the first dose of the Sinopharm vaccine yesterday. A total of 424,823 persons have been administered with the first dose thus far. The administration of the Sinopharm vaccine for journalists and state sector employees in Gampaha was carried out at the Gampaha District Secretariat. Accordingly, a total of 1,000 persons were vaccinated under the program. A further 1,734 COVID-19 patients were detected today. 1,516 fully recovered patients left hospitals today. Accordingly, total recoveries in the country has increased up to 121,145. A total of 24,810 COVID-19 patients are still receiving treatment at hospitals. 19 COVID-19 related deaths have been reported yesterday. The victims have been reported from Boralesgamuwa, Madakimbiya, Vaskaduwa, Maggona, Kalutara, Payagala, Moratuwa, Ambepussa, Gaul, Rambukkana, Polgolla, Katuwana, Padukka, Dambulla, Deniya, Hapugastalawa, Udapitiwala and Kaduwala. The proposal presented by Prime Minister Mahinda Rajapaksa to introduce guidelines for a COVID-19 emergency procurement process was approved by the Cabinet of Ministers today. The relevant cabinet paper has been submitted to procure essential items for health sector under the state ministries functioning under the Ministries of Health and Defence without any delays concerning the prevailing outbreak of COVID-19. Meanwhile, the government has declared the 24th and 25th of May as special holidays for the state sector. The relevant decision has been reached with the aim to successfully conduct the program initiated by the government to minimize movement in the country to curb the further spread of the outbreak. Also, steps have been taken to pay the salaries of state sector employees by the 21st of May. Steps have been taken to initiate an accelerated program to further strengthen the hospital system in Gampaha to face any incidents prompted through COVID-19. A special meeting in this regard was conducted at the Gampaha District Secretariat yesterday with the participation of Minister Prasanna Ranatunga.
The chief epidemiologist, Dr. Sudat Samaravira, says that COVID-19 vaccination is safe for both pregnant and breastfeeding mothers. He further added that the World Health Organization has thoroughly stated that inoculation of the COVID-19 vaccine is important for both pregnant and breastfeeding mothers as they are in a high risk of contracting the virus.
We know that the last long weekend, the country has very severe restrictions of movements, and we hope that that has been contributed effectively to control the COVID-19 in our country. Even after that, there is some restrictions for the movements, and the people who can come into the society is determined by their identity card numbers. In coming days also there will be more restrictions, and we hope that all these restrictions will help us to control the disease in the country, and we request all the people to adhere with these things, not to violate that, contribute and give their support to these travel restrictions, stay at home, not meet in other people. This will help us to rapidly bring down the number of cases reported in the country, and that will help us to control this disease very fast. Yesterday, the Advisory Committee on Communicable Diseases was gathered and discussed in length about the vaccination program and different aspects of the program, and some of the important decisions has been taken, and that we know that at this moment more and more pregnant mothers and lactating mothers are getting infected. Sadly, for deaths occurred among pregnant mothers. We discussed in length how to prevent this, and all are in agreement that lactating mothers should receive COVID vaccine. Any vaccine that is available can be taken by lactating mothers. There should be no restrictions for getting the vaccination because of the lactation, and also after vaccination mothers can continue the breastfeeding. They need not to stop the breastfeeding even for hours or days, that they can continue without any restriction the lactating. We discussed about how the pregnant mothers can be protected with COVID vaccine. World Health Organization also has advocated that if a pregnant mother is at a greater risk of getting the disease and also complication, they should be vaccinated. The College of Obstetricians and Gynecologists and also the Family Health Bureau will discuss in length about this and will provide recommendations among pregnant mothers whom should be vaccinated. And with these decisions, the Ministry of Health will take the action to vaccinate suitable pregnant mothers in coming days.
President Gotabaya Rajapaksa engaged in an observational tour at the COVID-19 Intermediate Treatment Centre in Siduwa this evening. The treatment centre, established in a building provided by Brandix plc, consists of 3 wards and has facilities to provide treatment for 1,200 patients at once. The centre consists of many facilities including state-of-the-art equipment to ensure the mental stability of the patients. This centre was constructed within a short period of 10 days jointly by the Sri Lanka Army and the Women's Services Unit of the Sri Lanka Army. Disabled war veterans had prepared 2,000 bedsheet kits for the newly established centre within a period of 24 hours at the War Heroes Apparel Factory. COVID-19 patients with mild symptoms will be treated at this centre. This initiative is expected to prevent the prevailing congestion in hospitals and allow medical health staff to focus more on critical patients. The treatments in the centre will be jointly carried out by the Ministry of Health and the Medical Brigade of the Sri Lanka Army. Secretary to the Defence, Retired General Kamal Gunaratne, Secretary to the Ministry of Health, Retired Major General Sanjeeva Munasinghe, Director General of Health Services Dr. Asela Gunawardena, Commander of the Sri Lanka Army General Shavendra Silva were present at the occasion. The Defence Ministry shifted to the newly constructed Defence Headquarters complex in Sri Jayawardhanapura Kotte, commenced its work auspiciously today. The Army Headquarters was moved to the Defence Headquarters complex a few years ago, and the headquarters of the Air Force and Navy will also be in-housed in the future. A greater output could be experienced once the Tri-Forces headquarters commence their respective operations in the same location in the near future. At the event organised to coincide the 12th anniversary of the Victory Day over terrorism in Sri Lanka, Defence Secretary Retired General Kamal Gunaratne declared open the new building complex amidst the blessings of the Venerable Mahasangha. To symbolise the new beginning, the signing of the official correspondence was held at the office auspiciously during the session. Meanwhile, General Gunaratne handed over the document to proceed with the recently announced cabinet approval for the lifetime salary and allowances payment for war hero dependents to the Tri-Forces commanders and the Inspector General of Police, opening a new avenue for the children of retired service personnel. Approval was also granted to enroll their children to the Defence Services College, Colombo during the session. This new state-of-the-art complex built with military expertise will house all the sections of the Defence Ministry that were previously situated in different locations.
A farmer from Ottapur area in Mahavali H zone has been able to successfully reap a harvest in paddy and other crops with the use of organic fertilizer. He said that a comparatively higher and quality harvest can be obtained from the use of organic fertilizer than from chemical fertilizer. A farmer named Sirinimal has been engaged in farming activities with the use of organic fertilizer during the last 5 years. The pesticides and herbicides necessary for cultivation activities are being prepared by himself. He pointed out that the use of organic fertilizer is more appropriate considering the future generations instead of the present. He said that much unnecessary expenditure can be saved up with the use of organic fertilizer. Therefore, he said that the decision taken by the President to ban the importation of chemical fertilizer is a timely move. He pointed out that many sustainable results can be achieved by the nation with the use of organic fertilizer.
The Presidential Secretariat says that the allegations levelled by certain entities over an alleged corruption occurred in the purchasing of 10 ambulances using the Itukama COVID-19 fund are false and completely baseless. The transactions of the fund are being carried out in a transparent manner and without any political interference. Presidential Secretariat has further indicated that the allegations raised by certain entities on the alleged involvement of the head of the Presidential Task Force, Basil Rajapaksa, are completely baseless and false. Financial provisions worth 194 million rupees were allocated from the Itukama Healthcare and Social Security Fund to purchase 10 ambulances. Accordingly, the President's Media Division issued a statement on the 10th of May regarding all expenditures related to the Itukama Fund. Accordingly, the price of an ambulance was cited as 19.4 million rupees. However, certain social media and politicians have made various statements over the price rates related to these ambulances. Accordingly, the allegations have indicated that an ambulance can be purchased at a rate between 8 to 13 million rupees, yet due to the interference of the head of the Presidential Task Force, Basil Rajapaksa, the relevant ambulances have been purchased at a price rate of 19.4 million rupees. However, the financial officer of the Presidential Secretariat, Ravindra Vimalavira, has completely rejected such allegations and has pointed out that the head of the Presidential Task Force, Basil Rajapaksa, is not a member of the Itukama Fund or the Presidential Task Force for the prevention of the COVID-19 outbreak. All relevant purchasing are being carried out through the Itukama Fund and the Sri Lanka Army. There are two types of ambulances used across the world, which are basic life support ambulances and advanced life support ambulances. Accordingly, advanced life support ambulances are being used for the transportation of critical patients and to transport patients from one hospital to another for further treatment. Therefore, the advanced life support ambulance consists of state-of-the-art medical facilities compared to that of a basic. The Presidential Secretariat has indicated that the ambulances were purchased under a transparent tender process and the tenders were granted for Future Automobile Private Limited, which had presented the lowest quotation in this regard. The Secretariat has also mentioned that the price rate of the medical equipment, including ambulances, have increased due to the outbreak and pandemic of COVID-19 as well as other higher dollar rate issues. And that wraps up tonight's Rupavahini English News. Join us once again tomorrow. Until then, thanks for watching. Have a great night.
Good night.